Guys, welcome to the Physique Factory Podcast with your hosts, Conor Moran and James Tilsley. Today, we've got a special guest on, Coach Josh Mchale. I'll let you lead the way, James, with this one.
Cool. So today we've got Josh on. If you don't know, Josh is my coach. He's been coaching a very long time. So do you want to say a little bit more about yourself?
Yeah, so I've pretty much been online coaching and for like the past 8-9 years, PTing for longer, like 10-12 years now. Started off in the gym just as everyone does, coaching the average client in the gym, and then transitioned into coaching competitors earlier on, like when I suppose it first got very popular back in the UKBFF days, if anyone remembers them. I started with 3 or 4 bikini girls at the time and did very well with those, winning shows and things like that. And I think that's where I kind of then got the niche of, prepping bikini competitors. And then as time's gone on, prepping more bodybuilders, more physique guys like yourself, which is nice because I've never had the intention of specifically coaching bikini girls. So, I wanted to coach as many different competitors and classes as possible.
Cool. Did you start with like the female clients at first, and obviously it just went into that because I think you like really, really well with that sort of things as well?
Yeah, I think it's like, again, like when you do well with any client and you look at any coach that kind of a particular client goes to them, it's because they've typically done well with that client, and that might not be intentional. Often it's not. It's just they have got like my friend Dan Welburn, he's known for like coaching figure girls because he's done well with those girls, for a long time. So typically they'll go to Dan Welburn if you're a figure girl, or and that's the kind of the way people view coaches, I think.
Yeah, cool. What you said, like you started up like PT, and where did you start PTing at?
Total Fitness in Wilmslow.
Ah, cool. Wicked.
Which is a massive gym. It's like one of the biggest gyms in Europe. It's got like an indoor running track around it. It's huge.
Yeah.
Obviously like a quite affluent area as well. So I moved from North Manchester to South Manchester to work there. And I loved it. And I think my advice would be to anyone, again, online coaches, go on PT first. Like you learn a lot about people and people's, how they think, how they act. And, you learn a lot that you can't learn online, especially if you're working with lifestyle clients.
Yeah, definitely. I mean, that's what me and Conor are pretty busy. We're doing like 40, 50 hours a week, like PT, and we're just trying to like grow that online thing now. So we've done the PT stuff. We've doing a lot of hours on the gym floor. It's about doing the online stuff now. Obviously, it's a little bit different. So there's a different way we got to go about it. But
yeah, it's different.
There'll be a lot of carryover there. You kind of get that rapport building and everything when you're with someone one-to-one, but that's possibly harder to do online. But you'll be able to carry over the skills that you kind of develop with one-to-one clients onto that kind of stuff. On yourself, Josh, you've competed yourself, haven't you?
Yeah, I've competed for the past 8 years, I think now.
Yeah, yes. How did you get into that?
I've always loved bodybuilding. Like when back in the college days, back in school, to be fair, I started training with my mates. And I never really like played any sports. I didn't really enjoy team sports. It used to piss me off when we'd lose because of someone else. So bodybuilding was like the perfect sport for me because it all depended on me and what I put in and what I did. And I remember like someone bringing, I think it was someone who worked for my dad, he brought home a DVD and it was Ronnie Coleman's training videos. And I watched that and I was like, fuck, this is insane. And then pretty much from there, I just started training more, taking it more seriously. And then did my first show, which was horrendous.
They all are, aren't they?
Yeah, this shows like the evolution of competing now, because you go to a first timer show now, the standard is just as good as any show.
What was your first show?
It was the UKBFF Northwest.
Oh, at the Par Hall?
Par Hall, yeah.
I did that as well.
Yeah. I did that, and then a couple of years later, I went to the British for the UKBFF, and I've done the NABBA Universe. I got 6th there in the Universe. Then I went on to do PCA, won the British at the PCA, and got my pro card there with those.
Nice.
That's awesome. Is it men's bodybuilding, I'm assuming? Yeah.
Yeah.
Oh, that's cool. What kind of class do you come in? And I mean, how do they work that with you guys? Because like, I know like in the natural shows, it kind of gets split into like lightweight, middleweight, heavyweight, but sometimes it can be like height based and things like that as well. Hey,
yes, depending on which federation you do. So if you do like PCA, it'll be height based. NABBA was height based.
Yeah.
Or if you go down the IFBB route, that'll be weight categories.
Yeah, that's cool. So where do you kind of fall there?
So I'll be a light heavyweight on the next. If I competed with IFBB, but I'm class 4, which is the dwarf class in
I would be that as well.
Yeah, the short class, the short guys.
With the federations, what's like the difference? Because I know there's people, they're looking for like different looks, aren't they? Like last year, FitX and PCA, there's people finishing like first or winning the actual British title for PCA and then doing the FitX and finishing nowhere near. I don't know what they're looking for in terms of like, I don't know, all different categories.
Yeah, I think like FitX are trying to align themselves more towards like the IFBB kind of side of things. So there's different categories in some federations. Like PCA, you'll get a class like train bikini, for example, which there's not like a similar class in any of the federation than that. If you go to like FitX and you're a figure girl, you'll pose like you would do at the IFBB, but there's a little bit different PCA. So there's all these different things, and some people will suit certain federations more than others, and certain classes more than others, of course. But like you said, you get a different judge, and this is bodybuilding, subjective sport as well.
Yeah,
someone's interpretation of what the criteria is can be different than somebody else's. So you can have one judging panel one day and you can place first. You can have another judging panel the next day and place fourth. And that's bodybuilding.
Yeah.
It must be confusing for you actually as a coach when you've got a client, right, I want to do this show, and this show, and you're like, fuck me, I've got so many different things, like what is this federation looking for, and what's the rules for this federation and things like that. It must take a lot of keeping up with from your behalf.
Yeah, exactly. Like you could have some females, for example, that want to do one federation where they've got to be absolutely peeled, and the next one where they might have to be a little bit softer. So it's, that can make things a little bit harder when it comes to like peaking for show days and how close the shows are together and things like that. But that's where I'll try and drive people towards the shows and the classes and the federations that will suit them best and that their physique suits the best. Because often you get people that are trying to do one class and they really don't suit it. So there's a new class in the UK now called wellness. And it's similar to bikini, but they're a lot bigger in the lower body. So the balance between the upper body and the lower body is very lower body dominant, where bikini is a bit more balanced. And a lot of girls think that now that they can be like a wellness competitor because they have bigger legs. And you get a lot of girls aiming for that class and competing in that class when really they should be in a bikini class.
Yeah. I mean, this is more for my own sake because I don't really keep up with the women's side of things that much, but like, what is kind of the difference between like bikini, figure, and do you get like athletic as well? Is that right? Just like and then obviously like women's bodybuilding. That's an obvious one. We know what that is. But like, what's the difference between all these classes? So
bikini is obviously like a little bit less muscled, not quite as conditioned as say a figure class, like an athletic figure. It's about having a look, having a certain balance to your physique. So bikini, typically the smaller girls, and you go into if you're doing like a PCA route, you go into like a toned figure class, which is a little bit softer, a little bit more muscle. Then you've got an athletic figure class, which is again an improved condition on the toned figure. So you're looking harder, leaner. And then you've got a trained figure as well, which is, a lot more muscle again, and conditions got to be on point there. So even in that figure class there, you've got like a softer type of look in the toned, and then like a really hard, bigger look in the trained.
Are you a fan of all these different classes, or are you someone that would maybe say kind of dilutes it a little bit?
I love all the different classes, and that's what I like about coaching, because you'll get certain people who go, you'd fit brilliant in this class, you'd fit brilliant in that class.
Yeah.
And I love that, because they're all challenging and demanding in their own ways. I mean, a lot of people think bikini, like, oh, you'd be able to diet for bikini, no problem, you don't need much muscle for that, that's easy. And it's not the case.
Yeah, definitely.
What's the prep looking like for, say, like females in like bikini? Or is it totally the same the way you approach it, or?
So obviously, like, the score with obviously getting leaner. You're essentially in a calorie deficit long enough, and this is where it's more so the client that will, if you got a certain look, we're saying we're going for figure, we need to be a little bit, we need to be a lot leaner. For example, if someone's doing athletic figure than, for example, a bikini. Now, these days, the lines are getting a little bit blurred because bikini girls are fucking conditioned, like they're lean. Do you know what I mean? So the lines are closing a bit in terms of what the condition requirements are there now.
Yeah, it's sort of just like size between them now.
Yeah, it's just mainly muscle mass, and again, a certain look that you want for that class.
Cool.
So there's not a drastic difference in terms of how you would set a prep up for each of those.
Yeah.
It would just be a case of how hard do we need to push to get that level of condition.
Cool.
And I suppose a lot of that's going to be dictated by your starting point as well.
Yeah, this is key, and I think a lot of people don't consider this. Like, obviously, the off season you need to gain body fat, enough so to gain muscle, and to regain like normal hormonal function if you've done a prep previously. But your start point will definitely dictate your end point. If you've got a hell of a lot of body fat to get off and you've got 20 weeks to do so, like realistically, for some people, that's not going to be long enough. Yeah. Especially like a natural athlete that can't use other things like thyroid drugs, clenbuterol, all those other drugs that will help get someone to that point. So the start point, sometimes you may have to diet someone before they start prep.
Yeah.
So they can actually achieve that level of condition. So you might spend 8 to 10 weeks before a prep pulling some body fat off, then running some like maintenance phase or even a small calorie surplus phase, just so they're in that position when prep comes around that they're actually able to achieve that end look.
That's cool.
I would break it up a little bit as well, because like for anyone that's never done like a contest prep, like it is pretty like a long haul, isn't it? It becomes, there's some shit points of it, but there's also some good points of it as well. But it'd be nice to almost, for some people, if you've got a lot of body fat to lose, breaking it up would be a lot easier than going, like 30 weeks of the trot or something like that. But yeah. I know people who have done that, and probably even longer, to be honest, majority of a year. I've probably done it myself some years as well, just like most of the year dieting, and it's just, it's not a lot of fun.
No, it's not. And again, like when you're prepping like natural females, for example, the toll that takes on them physically, mentally, emotionally, and hormonally, that can do a lot of damage, to some people.
Yeah, like the hormone side, how long would it take someone to recover? Like, say they've done a prep for about, like, say 18, 20 weeks, and what do you reckon? How long would it take for the hormones to get like balanced again?
Very person dependent. Some people will recover much quicker than others. Some can take a hell of a long time. It can take 6 months plus for some females to do that. And for example, when you get so lean as a female, your calories are so low, you're going to see down regulation in all of your sex hormones. So all of them will drop. Thyroid hormone will drop. You feel like shit. You can't function properly when you're in that kind of state. Your hunger signals are all over. So it can be a shitstorm for some people. So post-show, again, some people will have to gain a lot more body fat for the hormones to start, regulating normally and, get back into a normal range. Others can get away with it and they can bounce back so quick. Wow. And that's just the cards we're dealt as, genetically.
Do you get all your clients having like the bloods done after the shows just to check that then?
Yeah, like regular blood work. Again, even if you're a natural female, like there's something you still need to be doing.
Yeah, definitely.
I want to make sure everything's bang on where we need to be as we go through an off season, and you can get an idea of when things are actually back in range, because you'll see it when someone's hormones are in a terrible place like that. The body composition is going to suffer, the training is going to suffer. They just won't look the best, and therefore they won't feel the best, which is hard to process when you've just got off stage looking your absolute best, or what you perceive as your absolute best. So it's a tough thing post show if it's taking you a while for your hormones to get back to a certain place, and knowing that you have to have a certain amount of body fat for that to happen. That may mean someone gaining 20 kilos plus, do you know what I mean?
Yeah.
Which is a lot of body weight, and you're obviously going to feel very uncomfortable doing so.
I think it seems like a lot as well when you get so lean and then you put on some weight and you're like, you won't be fat by any means, you won't be overweight by any means. But compared to where you've been, you're like, holy shit, I put on so much weight. Look at the state of me now. And like, for males and females, that can be a bit of a head fuck, especially after like your first show or something like that.
That's another. Yeah. I mean, like, it's sort of like when I first did the show, and I've seen it in like bikini girls and stuff about like binge eating after shows and
we've all been there.
Yeah, I mean, I've seen like a load of like girls that they post about it a lot. The mental side of things. Have you like dealt with a lot of clients like that, Josh?
Oh, massively, yeah. Like I think this is one of the main struggles with a lot of people is the mental side of things. So if you're that way inclined, this is something you want to consider before you do jump into a competition prep. If you've struggled with past eating disorders, whether that be like bulimia, anorexia, just body dysmorphia in whatever way, shape or form, then, you know, it's not something you want to do lightly. What I would suggest for all people to do is before they do the first prep is do a mock prep. Do a mock prep, see how you find it, see how if you like it for starters, see if you enjoy it, see how well you can tolerate it, what impact is it having on you mentally, like is it changing your eating habits and all those kind of things, and then see how well you can then run like a post-show mock, you know, how well you can reverse diet and all those kind of things.
It must be hard for you to tell someone to do that because like everyone kind of wants something now, you know, they want everything now. But like, and being realistic, bodybuilding's going nowhere. You know, there's always going to be shows. I mean, apart from like that year, there was a lockdown and things were a bit all over the place. There's always going to be shows. So like, there's no sense in rushing it. So anyone that is thinking about competing, don't let all this stuff like put you off. But like, definitely, as Josh says, like running a mock prep would probably be a good idea, and just, you know, seeing how far you can take it, see what you look like, seeing if you're ready for it. Not that you'll probably ever feel ready, because every time you get lean, you're like, I could have more muscle there, I could have more muscle there. But definitely, I like that idea, Josh. It's a good enough idea.
Yeah, I've seen people literally start prepping for 2 or 3 weeks and stop.
Yeah.
You know, because they don't realize what it takes. Like they don't realize how they have to change the lifestyle around that. So again, if it's going to be like a massive lifestyle shift, like that can be a problem. We do this stuff day in, day out. We track our food, we train, we know what we're doing day in, day out, what we need to be doing. And our weeks pretty much look the same. We're creatures of habit, you know, bodybuilders are typically. So if that's not you and you're not doing them things anyway, and you have to do a prep for you to do those things, then that might be an issue.
Yeah.
You know, and I think a lot of people, again, a lot of what I talk about is like the psychological side of things, because that is the thing that impacts people the most. Like to get someone stage lean that will do exactly what I say is not hard. Do you know what I mean? It's not. If I've got like, if I was coaching me, for example, like someone tells me what to do, it just gets done. Do you know what I mean? Like whatever.
Yeah.
But not everybody's like that. There's the psychological side. People are always, you know, they struggle with how they look, like I said, day to day. Even when they're dieting and they're looking better, they can't see that. You know, so yeah. These are the struggles as a coach that you often have to deal with more than getting someone to look how you need them to look.
Yeah.
And which is, again, is why I think a mock prep, if you've never done a prep before, you know, is something you really should consider. And not only that, I like to work with people before we start a prep. So in an ideal world, I'd work with someone 6 to 12 months before we started a prep, because I can see what they're like then in an off-season setting. You know, can they be regimented with the food? Can they be regimented with the training? Can they even hit the water intake they should be having per day? Can they even get enough sleep? You know, all these little things. If I need to be telling like a seasoned competitor, you make sure every week, make sure you've had enough water, make sure you get enough sleep, then you're only going to go so far. Them things should just be so routine, and shouldn't even have to think about those things.
Setting the foundation, isn't it?
Yeah, them basics should be nailed down a long time ago. Again, this is why I like to work with people before prep starts, because we can lose weeks and weeks and weeks in prep if someone's not doing these things, and we're trying to have to correct these as we go.
Yeah,
definitely. I see a lot of that with, you know, like general population clients as well. It's just like someone comes to you and they're just not in a place to start losing body fat. And it's hard, again, to tell them. It's like, look, we need to work on all this stuff first and give you a good base to kind of go from before we can actually start, you know, putting you in a calorie deficit and things like that. So it's a hard thing to tell someone, but it is long term, it's going to yield much better results. So I suppose the take home from that is just like, be patient and enjoy the process, and get yourself in a good position to do this sort of thing.
That's the key there, is enjoying it. Like this should all be enjoyment. You shouldn't. It's fucking hard. Don't get me wrong. Like there's days where you just don't want to do stuff and you want to go and eat a load of shit, whatever. But you still should be enjoying the process. Like, it shouldn't be an effort in the sense like, I've got to do this today. It should just be so robotic, like, this is what I need to do. I'm just going to go and do it. I might not feel like it, but it needs to be done. It's like a good comparison is like, you don't want to go to work every day. Like, most people that work 9 to 5s, they don't bounce out of bed and go, I can't wait to go to work today. They don't. Well, that's bodybuilding. We're not going to do that every day. We're not going to jump out of bed and go, I can't wait to be fucking starving today and go and kill myself in the gym. You know what I mean? It's the same thing. They just need to be done. If you want that reward, if you want your paycheck at the end of the month, it needs to be done.
That's it. When you're setting people up for a prep, say the difference between males and females, how much is it? Like, what have you got to think? What's the difference
between males and females?
Yeah.
So again, like, females, a natural female or even a natural male, because you're gonna have the same issues there in terms of the down regulation of hormones and the impact that it has on them. The way I would like to see a prep is, for starters, male and female, is someone to be ahead of where they need to be. I don't want to be chasing fat loss right up to the last day.
Yeah.
So if we can start early and go in more aggressively, then that would be the ideal situation. We're getting a lot of work done in that first half of prep. We can then afford to run maintenance weeks. We can manage recovery better. We can increase calories along the way. You just got more room to play with at the end, where then you can be going into a peak week around maintenance calories, nice and fresh. Because again, that's going to affect the look. If you're going into your peak week, like, fatigued out your brain, running low calories, zero carb, you're just not going to look the same as soon as you start to load them, carb load, for example.
Definitely. That's cool. And then with the phases with the females, obviously you got like your luteal and follicular and stuff like that. How do you structure like training and nutrition around those phases?
So obviously, like, with the follicular phase, post, day when you start your bleed, for example, and you just gradually start to see estrogen rise through the follicular phase there. And this is where people will generally feel the best. They'll be able to push harder in the gym. They'll feel good. And then post-ovulation is probably where people will start to come down on that slide, if you like. And, roughly a week out from the next bleed is when they'll typically start to feel a bit shit.
Yeah.
Motivation will be down. You'll be, the sleep might start to suffer.
You see a difference in like scale weight then as well?
Yeah. So around, again, person dependent, and this is why I like to get females to track the cycle. They'll see a spike in body weight usually around a week before the cycle. Day 3 of the bleed, for example, you start to see that weight fall off again as the hormones are changing. So this is where I like to use like a reps and reserve with females, like the end of that luteal phase where before the bleed is when they're feeling a bit shit. That's not the week you want to be pushing for PBs. It's not the week you want to be pushing volume, sky high. So that's where we might utilize like reps and reserve that week and just be a little bit more aware of how they're feeling, and if they need to take an extra rest day, we'll do that. And this is where cravings will be high as well. Like the cravings will go through the roof at this point. So they might not be as insulin sensitive around this time, but this is where it might be a good idea to throw some extra carbs in, just because of this is where people are most likely to binge. Like, if they're going to binge or they're going to overeat, they're going to do it now. So I'd rather pre-plan that and say, right, we're going to run higher calories. And I've done this with a lot of clients where we allow that week before, when they feel really shit, I allow more calories that week and I just pull them down the rest of the month.
All right, cool.
So the monthly intake's still the same, but it just helps manage that week where they tend to overeat and feel really shit. Because the hunger then can drop off massively, like day 3, day 4 after the bleed. And they can get by just fine on even lower calories. So, you can always play around with that as well. Again, person dependent. Some people, a lot of clients, they don't feel a difference. And you'll see this in some of the studies, like there's not been any noted change in strength or anything like that when they're training, but some will. It's just very person dependent.
Yeah, I remember when I first started learning about this kind of stuff, I noticed it within clients. There's like certain clients would, be by the book, everything that I said when I was like studying this kind of stuff was coming true with them. And then other ones, it wouldn't seem to affect them at all. Didn't seem to bother them at all that way. Maybe they just didn't voice it, but you could kind of tell with some of them, training performance was going down, things like that. Hunger levels were going up in their tracker sheets and things like that. And you're like, okay, that's exactly what it says it should do, almost exactly what it said in the tin. And then others, it was just almost totally random. And I suppose that takes us on to the next thing. How do you consider, when women are using the likes of contraceptive and things like that?
So obviously, if someone's using a contraceptive, they're not going to go through a normal menstrual cycle. This doesn't really apply to them because there's some contraception you just take all the time, whether that's the injection or the implant or just a pill you take back to back continuously.
They're not going to cause fat gain.
Which one causes fat? So I think it's the injection and the implant that are typically worse for that. Yeah. If you look at like the data on it.
Why would that be? Do you know?
Increased appetite generally.
What was it?
Yeah.
But I mean, there's a lot of other things that are going on when you're putting exogenous hormones in.
That's it. Yeah. When you start like mess around with your endocrine system, it's hard to tell exactly what's going on, I suppose. It's something personally I need to learn more about. I'm sure you guys might be a bit more clued up in it for other reasons.
Yeah, so I mean, you're not going to go through those luteal and follicular phases if you're on contraception. You're not ovulating for starters. So, and again, most of the progesterone that they use in these contraceptives, they're not actually progesterone. It's called progestin. It's like a synthetic version.
Synthetic, yeah.
So if we're looking at from a health perspective, it's probably not the best thing to take. It does the job. It stops you getting pregnant. That's exactly what it does. Yeah. Do you know what I mean? Apart from that, like it's not very good. You're shutting down a hormonal system and a hormonal axis there, taking it just like a man would do taking steroids.
Yeah, I suppose as a coach, you've kind of got to say, look, here are the benefits, or here are the risks, and then kind of make your own choice from there. I suppose that's all you can kind of do on that one as well. You can't really, I suppose, be telling people what contraceptive and that to take, but you've kind of just got to put it out there for them. It's like, look, this is the benefits of this one, this is the risks of this one. Do what you want from there, almost. Yeah,
I think it's making people aware of how it will impact them, because I think because a doctor gives it them, it's like, oh, they'll be fine.
Yeah,
they don't realize that it's linked to like higher anxiety. All those other kind of things, like your nutrient demands might increase, like B vitamins and stuff like that. So you've got to ensure that you're taking enough micronutrients through vegetables, through fruit. Again, something a lot of women don't do, and men probably worse than women. But it's these little things that you need to be doing day in, day out, and even more so you're on your contraception as well. Some girls I spoke to, they didn't even know that they could only get pregnant like 5 days of the month. Like literally, some girls actually thought they could just get pregnant any time of the month. So I think there needs to be more like education and learning around that and the alternatives to it.
Yeah, definitely. I mean, in terms of my female clients, I've been trying to track like the cycles and implement like the training phases, but it's sort of hard like with doing that straight away. You need to see where the cycle's like, if it's like a regular or if it's up and down, and give it a couple of months before you actually start programming in like nutritional and training variables around that to change it, haven't you?
Yeah, you might want to track the cycle for 6 months and see how long it lasts, because again, there's that fallacy that every cycle is 28 days long, which is not the case. Like some people's normal cycle could be 36 days, and that could be normal for them, and that's fine. Some people, like again, if it's really long, like 40 plus days, obviously regular, sometimes they don't get it. You might be looking at things like PCOS or something like that. But again, the more we can hammer down these basics in terms of sleep, stress management, nutrient intake, like that's going to have a positive impact on regulating a cycle. So then the fundamentals there will cross over to anything you want to do. Like you want to improve your overall health, look better, like that stuff needs to be taken care of all the time.
Yeah, definitely. I think you just touched on something then, PCOS and things like endometriosis. Have you worked with a lot of clients with those?
A lot. My girlfriend has PCOS, so
right.
It's something that's so common that most girls don't even know they have it.
Yeah.
There's different types of PCOS. There's all sorts of different types of PCOS. There's usually the similar symptoms are like high androgens, things like irregular cycle that, you see them and you go, hang on a minute, this might be worth looking into.
Yeah, one of my clients, he came back, she had PCOS and she had like higher testosterone levels because of it. And then it was harder for her to like lose fat. And I thought, wow, it's all like linked together. So it was really interesting.
Yeah, but absolutely smashing the weights in the gym though.
Typically,
every session.
Yeah. Girls with higher androgens, you'll see they'll look a certain way for sure. But again, like the main thing with PCOS or anything like that, endometriosis, is managing inflammation and insulin sensitivity. You know, they're the two things you really want to take care of. So again, eat your vegetables, get enough sleep, manage your stress. Like, honestly, I can't stress these things enough because they're so underlooked, and there's stuff that you can do day to day. Like when you're dealing with hormonal issues and things like that, you know, even like with clients, you know, what kind of environment they're in at home, like, is it a stressful environment, they're in an abusive relationship, like, all, you know, these are constant stresses on someone, and they will all have a massive impact. If something's happening day on day, you know, that's going to take its toll.
I think a lot of people don't realize, you know, training hard is a stress in the system, you know, like being in a calorie deficit is a stress in the system. And I suppose, like, this is prevalent for males too, but you see a lot of females, like you maybe get a female that's doing a lot of cardio and then they're training hard with weights and they're barely eating any food and things like that. And then as you say, all these external stressors as well. And they're just not in a great place. And nailing those fundamentals, as you say, that's got to be the main thing for anyone really before they undertake any sort of diet prep, things like that, just like what we said earlier. But I think people have kind of got to realize that all these things take their toll on your you know, your nervous system and things like that. And yeah, they can all be managed, but we kind of need to get that in place first.
Yeah, if someone's going into prep, like, you know, again, you're looking at stresses, whether that's physical, mental, whatever that may be. If you're going to prep with a regular menstrual cycle, poor eating habits, poor sleep, like a really stressful home or work environment, and then you're throwing a massive calorie deficit in the mix and training on top of that, and they wonder why they're not progressing or getting results or looking worse, like, you're asking for it. Do you know what I mean? Like, you
Go back to the kind of cycle sort of thing, like menstrual cycle sort of thing. Do you see a lot of like amenorrhea and things like that with women when they compete?
Yeah, again, very different. It's more common than it's not. So a lot of people, more girls do lose the cycle than keep it. I've had girls that are in great condition and then come on the period on show day sometimes, which is not what you want. No, that's not what you want. But
is it like a certain time into prep where it can happen or occur after dieting, or?
Again, person dependent. Some can get two months into dieting and lose it. And what you'll see, again, like I was saying about the difference in girls and the genetic individuality that there is, that some girls will be affected massively by a calorie deficit.
Yeah.
So as soon as they do go back into a deficit, them hormones drop right straight away.
Well,
and that is then setting them up for a much harder prep.
Yeah, and it's not a healthy place to be either. It's something you obviously want to regain as soon as you possibly can. But I suppose at the end of the day, a show prep isn't a healthy thing really, and it's just something, a temporary thing essentially, and then you want to get back to kind of full health as soon as you can after that, really.
Yeah, and that's like the last podcast I did. This is what we was talking about, where these hormonal interventions might be of more benefit than detriment. Like in a lot of cases, or in some people, it can be much more unhealthy competing naturally than assisted, because at least you can sub in them hormones through exogenous ones, whether that's thyroid, testosterone. You know, if you're putting yourself in a healthier hormonal position, even if it is exogenous hormones, it's going to lead to a much better look, how you feel, how you perform.
Yeah.
And then you can take those things out once you're back into a calorie surplus.
I think the big thing with that side of things, male and females, is you'll see a lot of guys using, you know, different steroids and things like that don't have a clue what they're doing and taking a cocktail of stuff. And yeah, that's not gonna be beneficial for most people.
Not at all. And again, it's another stressor, like the stress that has on your organs, for starters, on your brain. You know, if you're running a hell of a lot of drugs at the back end of prep, you can look a lot worse for it.
Yeah, definitely.
You know, I've seen that before, where you reduce someone's drugs and they look and they feel so much better for it, because they just reducing another stressor.
As for females, in terms of like drugs, what are the common ones, say like a figure competitor would take?
So a very common one would be like clenbuterol. You know, it's a stimulant that's going to help them burn more fat. and a common anabolic. These are the two most common used in pretty much all classes. Would be like an Anavar tablet, which is an anabolic and androgen. And again, that comes with the obvious risks as a female. You know, you take too much androgens for too long, you will start to virilize. You know, your voice will drop. You start seeing facial hair gain, all that kind of stuff. And again, there's a massive lack of understanding and knowledge around those areas. Again, these people just going, oh, well, she took that. She told me to take that and she felt fine, you know. And then you look at these people and you're like, well, listen to how they speak. That's not, you know, and most girls don't really want a manly voice, let's face it, do they?
I suppose like with everything we've talked about today, it's going to be individual, and it's just because one person's took this like a stack of drugs doesn't mean that's going to be right for you either, and like different doses and things like that. And I think for me, like being a natural competitor, when I listen to like even what you just said there, I'm like listening carefully. I'm like, what the fuck is this stuff? And so many people will be going into like taking steroids and things like that with the same lack of knowledge on it that I have. And when like you always get people, when you're natural, you always get people, oh, would you ever go on? And I'm like, I don't have a clue about any of this stuff. I'm not going to start taking like different like supplements, steroids, things like that I have no idea about. But too many people do, I would say.
The vast majority do. The problem is when people do research, like they're learning from the wrong people as well.
So where would you go to learn about this kind of stuff? It sounds as if I'm like going to get on Psycho after this now. Like where'd I go and learn about this?
If I was going to learn, you know, if I was starting out and I was wanting to learn about all different types of PEDs, there'd be Joe Jeffries putting a lot of good stuff out on the Physique Collective. If you've got Victor Black, who's got a website who's pumping out loads of information on a safer use models. These are as well. They're not just education; they're educating you how to use it as safely as possible, because it's never going to be safe, but it's as safe as possible. And this is what I try and pass on to my clients.
That's it. I think ever since I've started working with you, a totally different approach in terms of like PEDs, and I feel way better for it.
Yeah. Things like that, I mean, and this is again going back to the individuality of people. Someone can take X amount of drugs and feel brilliant, progress great. That another person could take that amount and they could feel horrendous, high fatigue, no appetite. You know, they're seeing a lot of side effects, whether that's somewhat, you know, aromatization effects. You know, so it's just working out and again working with that person longer to understand what they can tolerate, where they perform best, and you're constantly gathering information on people.
Yeah, I think the take-home thing is every time we talk about training, nutrition, or anything like that, it's always like who we're talking about, isn't it? Like who's the individual, and it always comes down to that.
Yeah, it's like if you're setting up a training plan for someone, what does that person need? That's the same thing across the board. What do they need? What nutritional interventions do they need? Do they just need a basic? You need to just fucking sleep more, drink some water, and eat 4 or 5 meals a day, you know, and that will then see them progress massively because of the point that they're at. Where you've got a higher end competitor, they might need these small tweaks in the PED stack, or you know, the more individual or approach to the training, where they might need to tweak small things. They might need to start paying attention more to specific body parts, for example, where the training split might need to bias something and something else might need to take a back seat. For example, like a physique competitor, your legs could afford to take a back seat because you're not getting judged on your legs. So let's specialize this training program around your chest or your delts or your back, you know, things like that. And it's just about understanding what people need and where they're at in the journey.
Yeah, when you mentioned kind of training, it was something we meant to ask about, and Josh, not Josh, but I'm forgetting your name here, James. James was scared to ask you about this in case you programmed them in, but like women generally kind of love to train legs. You always see a lot of like things like crab walks and things like that. So like, I mean, what would you kind of do you generally find you have to drive women towards doing like upper body stuff and things like that, or do you have to take them away from things like crab walks and take them towards like maybe more compound lifts and, you know, things like that? How do you find that usually goes?
So the majority of girls that come to me, they're probably way past like the crab walk type of stuff.
So you don't program them in?
I definitely do not.
I thought they were in James's program.
If you see him walking around the gym doing that, you better tell me.
On a treadmill sideways.
But again, that's a perfect example of someone probably just looking at Instagram. That girl's got a good bum. What's she doing?
Yeah.
She's selling your hopes and dreams, and that's it.
With the females you get coming to you, do you ever have to like dispel these things saying, oh, I really like doing this sort of shit? And you're like, no, just don't do it. Or they've got like some sort of attachment around a certain exercise.
There's a lot of things like, there's a lot of things you have to change with some people. And a lot of it can be the lack of understanding of a process or the lack of understanding of training fundamentals.
Yeah.
And it's just, and they're not far off the mark sometimes, but there's tweaks you like, they do this and they go, oh, well, I feel this there, so I do that. And I'm like, well, you know, this is training the lengthened part of the muscle, so that's why you're going to feel it there. And then we're going to transition into training something in the shortened part.
Yeah.
You know, and they're going to work synergistically like that. And I think it's just some people don't understand why we're doing that. And they go, I feel this movement here, or I don't feel it there. And girls, for example, oh, I feel it all in my quads, this. Do you know what I mean? And I think there's a misconception where if you're training your glutes, everything should feel like a kickback type movement.
Yeah.
So you should feel that short and tight pump. Whereas like if you train something in a shortened position, it's going to feel a hell of a lot different to train something in a lengthened position, isn't it?
Yeah. Definitely.
You're not going to get the same feeling. And I think there's a lot of sensation-based training. Again, that's why these bands work, because you feel that a lot in your glutes.
Yeah.
Do you know what I mean? But like, I could go and run a 5K and I'd feel that in my legs for fucking 3 weeks. It doesn't mean it's building muscle on my legs. Do you know what I mean? So we can't confuse sensation with it being good, because like sensation could mean something's bad.
It's like people doing like RDLs, putting the feet on blocks and loading like nerve and things like that. I mean, that's sensation. Again, it just translates into doing the bands and all. I'm not saying it's going to load a nerve or anything, but just sensation. You're not going to get really much out of it.
I had this a few weeks ago with a client that she sent me, you know, the toes elevated RDL.
Yeah.
And simply just because someone said, oh, put that on your toes, you'll feel it more. And like, you feel it more, like you said, because you're stretching your nerve.
I feel what more?
Yeah, like what does this, you know, you're stretching a nerve, you're not changing anything in your glutes.
Yeah, your glutes don't cross your ankle.
Yeah, exactly. It's not having any impact on your glutes at all. So there's things like that you might have to like just educate people on and make them understand why they're doing certain things. Like, we're going to do this because, rather than just go, no, you need to do that, it's good for your glutes. Do you know what I mean?
Something I've found is you'll get someone, I've got a client in mind, like they're maybe not got a hell of a lot of hip flexion. So like something like a squat is not really an ideal exercise for them. They can't really get a decent enough depth to really get a lot out of it, but they like that exercise. And sometimes it's just like, okay, you can have that. Okay, it's maybe not ideal for you, but you can have that. And, you know, just letting them do their squat or do their crab walks or whatever, because to them, you know, that's great. But knowing as well, right, we're also going to do this other stuff that is going to be more effective.
Yeah. And again, as a coach, I think if I was coaching someone like a lifestyle client, that'd be fine. And I think this is the difference where, like, if I'm coaching someone to win a show, like, there's things that we can't compromise on.
You're like, fuck your crab walks.
Yeah. Yeah. Like, they're going. But like a lifestyle client, if they fucking enjoy that, crack on, because they're probably not training hard enough for it to make a difference anyway.
Yeah.
Do you know what I mean?
Don't say that. Some of my clients may listen to this.
No, but you know what I mean? Like, when there's training hard and there's training hard.
Yeah, definitely.
You know what I mean? Like, some people can afford a little bit more volume, where others can't. And then this is another thing that, again, like with female men and women, like, it's just finding that sweet spot with volume and what someone can and can't tolerate.
Yeah, I mean, for me, like, we do like the low volume approach, and there's other people in the gym where they're doing like fucking 5 or 6 sets of things. I'm like, fucking hell, that would kill me, absolutely kill me. And they're recovering fine, but again, they're not training to as intense as the 1 or 2 sets that like we're doing. But
yeah. Again, very person dependent.
Yeah.
So again, like when you're training or coaching someone, it's just about gathering that information and seeing what someone can tolerate. Like, we've ran like a volume escalation with your training, and that just then tells us, like, right, after we've done this amount of sets, you can't progress. So that's the max recoverable volume you can tolerate.
Yeah.
As an individual, where someone, they could keep going and going and going, And again, that's down to how well you can recover because of how hard you can train and things like that.
Well, I really like the approach that we did, where it's just like body part dependent, where we're taking up the volume instead of what I've done previously is take up everything all at once, and then I'm fucked after 4 weeks.
Yeah, again, when you're dealing with people that have got a higher training age, their needs are massively different. They can't grow systemically all like they used to. Yeah. You can go into the gym and do a push-pull leg session and everything just grows when you've never trained before. But then further down the line, you'll start to see that you're not really getting the same kind of progress you used to. So something has to change. You might need to spend more time or more volume on certain body parts for them to grow, which means the volume reducing the other body parts so you can cope systemically with it.
Definitely, it's worked 100%.
Yeah, it definitely does. So even with myself, that's the kind of approach Joe's had with me, and that's where I pulled some of these things from, which again you can pass down to clients, which is why it's always important to have a good coach that's constantly learning, and there's no biases towards anything. Like you said before, like you get either like these people who swear by low volume and low volume only, and the people that swear by high volume and high volume only. But there's a middle ground there, and that middle ground is where you'll probably progress the most.
That's it. I mean, it just comes down to the person. It's just that's always the answer.
Yeah, always. Always.
I think we could wrap it up with that. I think we kind of covered everything there, didn't we?
Been good.
Yeah, that's a good one. So yeah, I mean, any final words, Josh, just for like, I suppose men or women who are new to training, and are kind of, I suppose, struggling to see results?
I would make sure you're learning from the right people. And I would look at the results people are producing. So if you're going to learn from someone, make sure they're producing results, and make sure they're putting out valuable content, not just junk on Instagram. I think
don't go to the Physique Factory.
It's hard, I suppose, with social media these days. There's that much information out there, can be information overload.
Yeah.
So don't expose yourself to too much, because that can be the problem a lot of the time.
100%.
And I suppose with that, people changing approaches all the time. They'll do one thing for 1 week, one thing for the next week. Like give it some time, run something for a while, see how it works for you. And if it's not working, try something else. Yeah,
I think that's it. If you find yourself chopping and changing every week to something else, that's probably the problem.
Yeah, there's no consistency.
No.
Perfect. Right, so we'll wrap it up with that. So thanks for listening, guys. And if you've any questions for us on any of that stuff, feel free to head over to our Instagram at Physique Factory, Physique_Factory_coaching. And yeah, cool.
Yo, cheers, guys.